the top of the priority list. So before we get started, a few notes on housekeeping as we begin. You can all feel free to talk amongst yourselves in the chat box throughout the webinar. I know a lot of you know each other, so stay connected there. But if you have a question for the speakers or the panelists, please drop that in the Q&A box. And we'll either answer that in written form throughout the webinar as we have moments, or we'll tackle those at the end of our time together collectively. And the slides and the recording are going to be sent out to all of you in a couple days following the webinar. And so you'll have a chance to go back through all this content at your own pace as needed. I'm so pleased to be back with you, at least virtually, today. In fall of 2019, after the last legislative session, I had the pleasure of visiting with many of you on our first Texas tour, where we provided a debrief of what happened last session, what it meant for the El Paso community, and most importantly, gave us the opportunity to meet you and listen to you and learn more about the opportunities and innovations of what's happening in El Paso, as well as the unique needs in your community. The Paso del Norte was the generous host and partner with us for that event, and we had the pleasure of hosting Representative Gonzalez and Fierro at that conversation as well. And at that time, we promised to come back before the next legislative session with priorities in hand after all the listening and learning, and promised to stay connected and to help bridge the many miles, both figurative and literal, between what's happening in El Paso and what might be happening in Austin with policymakers. So here we are, we're back, and we brought some of our friends who are going to be able to outline lots of different places where you can get involved and lots of different policy priorities that are going to be good for kids this session. So we're going to get started this morning with one of your own, and I'm going to hand it off to Laura from Paso del Norte. Thanks for joining us, everybody.
Hi, everyone. Thank you, Jennifer and the Text Protects team. On behalf of our CEO, Al Velarde at PDN Children's, we really just want to thank you again for bringing this presentation back to our community. It's different than what we expected, but nonetheless, we're happy to be doing this. Before I speak, we can go to the next slide, I think. Before I speak a little bit about one of our new local initiatives that you see here on the slide, I also want to recognize Katie Mitten from Texas Care for Children and Sabrina Gonzalez from the Texas Council for Developmental Disabilities for joining us and sharing their expertise today. Over the last several months, PDN Children's has had the opportunity to collaborate and add our support to very important communications related to ECI policy, thanks to our work with the ECI Advocacy Coalition and Katie. And also because we are one of 2 ECI providers in El Paso County, it's very crucial that we as an organization stay involved and also bring our voices and the voices of the families we serve to policymakers in Austin, which is, you'll see the underlying theme of this and many talks, is bridging those gaps. Our organization also has had many years of partnership and collaboration with the Texas Council for Developmental Disabilities. They fund many of our programs. And so this work, we thought, you know, it was really important when we wanted to bring people to this conversation, to add Katie and Sabrina and continue again to bridge the work we're doing locally with the efforts that are occurring statewide. So thank you, Katie and Jennifer and Sabrina, for being here today. Next slide. So what I'm going to share with you today is a little bit of background on a new local initiative that's in its very early development stages, and that is Help Me Grow El Paso. So before I talk about Help Me Grow El Paso specifically, I want to start off with a little bit of background on Help Me Grow itself. So Help Me Grow is a system model, a sort of roadmap for creating a comprehensive and highly integrated system of supports for communities to do two of the following. And the first is early identification of children who are at risk for delays in development or who may be exhibiting some concerns in behavioral health. The next is taking that early identification process and then directly linking families to the community-based supports and services that are already existing in the community to help them thrive. The key factor in the Help Me Grow model is that it's for all children. The reason why this is important is because historically with early detection, you'll see that efforts may primarily have focused on children with the most significant delays or disorders. And so we know that the work being done in the community to kind of meet those gaps is crucial now and as we move forward. Next slide. So the Help Me Grow system relies heavily on the cooperation of 4 key components. So you'll see those here on the image before you. The first of these very important components is the concept of the centralized telephone access point, which is used for connecting children and their families to a grid of services and care coordination. This sort of one-stop shop is where families can go to get resources and also speak to an individual who has a specific higher level of knowledge in early childhood development and can facilitate a soft handoff to the services that will help the family thrive. The next component is the community and family outreach component, and that one is in green. This builds the parent and provider understanding of healthy childhood development. So that constant awareness building and education to support not only the services that are existing, but supporting families in getting to those services and having the awareness of, for instance, the centralized access point. On the next gear that you'll see is the child health care provider outreach component. And this part is very crucial for gaining that buy-in that we need from medical providers. Medical providers are often, they're the ones that are interacting with their clients and their patients. So if we have their support and their knowledge of the Help Me Grow system, we can better connect not only them, but they would have the awareness to connect their families to the grid of community resources. The fourth and very important component of the system is the data collection and analysis. This portion guides quality improvement to ensure the resource grid itself is working effectively. It'll support the evaluation of the program, help us identify any system gaps in services, and bolster advocacy efforts, which is especially important right now in our starting point, because this is where we can start as groups to examine necessary policy changes or potential funding allocation that we would need to bring this to a statewide level. Next slide. So the cooperation of the 4 components that we just talked about is what helps the system arrive to what we see here on this image. So what ultimately we want, right? Families, providers, and the greater community sort of plugged in to a resource power grid of education, healthcare, and family support services. So it's all about not necessarily creating something new that doesn't exist, because we know that there are many resources that exist within every community, and especially our community here in El Paso. But it's how do we capitalize on that and maximize the efforts to better meet the needs of children and families. Next slide. So replicating the Help Me Grow model to support Texas children and families, our plan for this sort of statewide implementation. So we've covered some of the background concepts of Help Me Grow, and now we'll take this next few minutes to do a shallow dive into what this rollout looks like in our community and the state. Next slide. So visually here, we have the Help Me Grow national system, which provides a lot of the technical support for the states that are seeking to implement the Help Me Grow model into their communities. Next, we have Help Me Grow Texas, who is identified as the state lead, and they will oversee our local efforts here in Help Me Grow El Paso. Next slide. Help Me Grow Texas. So Help Me Grow Texas is led by the Division of Maternal and Child Health, which falls under the Department of State Health Services. On the map here, you'll see that the Department of State Health Services, as the lead, an organizational lead, they selected 6 cohort communities based on, the following criteria of readiness, community readiness, the need in the community's capacity to build this sort of system, and the infrastructure. And you'll kind of see from the image here on the map, our community here in El Paso is sort of still very far removed from the rest of the communities in the cohort that are focused on the central part of our state. So once each community is identified, which we have been, they designated a local organization lead to help support the community efforts. And that brings us to Help Me Grow El Paso. So next slide. So the successful implementation of the Help Me Grow system relies greatly on a few key steps, which we've already begun. So the first part is the designation of a project organization lead. In our case, that lead is our organization, PD and Children's, headed by our Chief Operations Officer, Gilda Gill. So she is the project lead for our El Paso area. The next step is to identify and recruit partners in the key areas of early childhood to help make sure that this system launches and works in our community. For us, you'll see that I have the logos here of the organizations. It includes our organization, PD and Children's, the Paso del Norte Health Foundation, Del Paso Center for Children, Del Paso Child Guidance Center, and Aliviane. And these are what is known as the partners that will ultimately be making the recommendations to see how this system will eventually launch in El Paso. The next component for the successful implementation is the ongoing technical assistance that we are receiving from Help Me Grow National. So that first tier that we saw looking back at the image before. Help Me Grow National is the sort of umbrella that's going to support all the states with the technical assistance and ongoing process to help launch this system in our community. Next, each cohort community had to show commitment and show how they would bring fidelity to the Help Me Grow model. We also had to establish a plan that is going to help us meet the structural requirements for getting this system up and running in our community. And so as you can see from the last bullet, especially as a cohort, we are charged with assessing and exploring what Help Me Grow will look like in El Paso. Because what we've learned so far from this Help Me Grow model is it looks different in every community. There's no one way to have it work for us. So this also is going to inevitably include us making recommendations based on our experience, based on the work we've done so far, to perhaps leaders at DSHS and state legislators. And this will help us inform potential policies or funding allocations that will get Help Me Grow really started in our state and get it going. Next slide. So again, that was a really brief and overview of what Help Me Grow is. And as we continue this project planning stage, it's all with one goal in mind. And that is, as you can see here, helping all children access the supports and services needed to reach their greatest potential. And we are so looking forward to continuing the work we've already started with not only the partners in our community, but with statewide leaders and legislators, policymakers, to make sure that we get Help Me Grow launched statewide. So again, thank you all for joining us. I know this was a really brief overview of what Help Me Grow is. It's just the beginning. There's so much information, but I didn't want to really overload Myself and my boss Gilda Gill, who is the project leader, we're here to answer any questions today and ongoing. This is an ongoing effort, and there are constant conversations happening in relation to Help Me Grow. And what we really want is just to keep doing the work with our partners to support families, especially in the early childhood sector. We know that intervening in the earliest possible point is what helps families thrive. And so that's what we want to do. So again, here's Gilda Gill's information. You can email her, and I'll make sure to put my contact information in the chat box if anybody has questions about Help Me Grow. And then now I'll pass it off to Katie, Miss Katie, who leads the ECI Advocacy Coalition at Texans Care for Children. She's going to give us a rundown of the coalition's priorities for the 87th legislation.
Thanks so much, Laura. We can go ahead and go to the next slide. As Laura said, my name is Katie Minton. I'm the Health Policy Associate at Texans Care for Children. I'm really excited to be here today to talk to you about some of our priorities related to early childhood intervention. Next slide, please. Texans Care for Children. Some of you may have had the opportunity to meet my boss and also our CEO, Stephanie Rubin or Adriana Kohler, during previous in-person presentations in El Paso. At Texans Care for Children, we are focused on driving policy changes that improve the lives of children and their families, and making sure that we have a strong Texas for tomorrow. We work on several different issue areas that you all might be interested in. We work on early childhood education policy, child welfare, children's mental health, maternal health, children's health, which is my focus area. And within children's health, we facilitate the Early Childhood Intervention, or ECI Advocacy Coalition, that Laura mentioned that she participates in and is a wonderful contribution to the group. So today I'm going to talk to you about the Early Childhood Intervention, or ECI Advocacy Coalition, priorities for this session. Next slide, please. So we'll go through quite a bit in a short period of time, but first we'll talk about, just a general overview of what ECI, or early childhood intervention, is, what the key challenges the program is facing right now. We'll talk about the budget, which is a big part of the challenges that the program's facing. And then we'll talk about three bills that, three bills that you see listed here that are the top priorities for the ECI Advocacy Coalition. We can go ahead and go to the next slide. So some of you on the call are work for ECI providers. So some of this is you know this better than I, but for those of you that aren't as familiar with early childhood intervention, or ECI, it's an effective federal state program that contracts with community organizations to provide life-changing therapies and services to kids under 3. This could be kids with autism or speech delays, Down syndrome, or other disabilities or developmental delays. ECI is what is known as the Part C program for Texas. Some of you might be familiar with the Part B program, which is the school age program for kids with special education needs. Part C is the program for little kids under 3 that haven't reached school age. And we know by serving kids during these critical first 3 years of life, which is a time of rapid brain development, ECI has been proven highly effective in helping children learn to walk, communicate with their families, and get ready for school, or meet any other goals that they need to meet on an individual level. In El Paso, Paso del Norte Child Development Center, at the Region 1 Education Service Center, are the ECI providers in El Paso. So you guys might be familiar with those. And you'll see on the slide in this box, there's just a few examples of what some of the great services that ECI provides, things like speech therapy, nutritional or feeding instructions, physical therapy, occupational therapy, and those are only to name a few. Right now, Texas has 41 ECI contractors, and in 2019, they served over 60,000 children. And then finally, something that's important to know is that ECI uses a coaching model where therapists coach and teach parents how to interact with their children and provide the needed supports for their children. Parents are taught exercises to help a child learn to swallow or crawl or adjust to any sort of special need. The coaching model has really helped ECI providers transition to telehealth during COVID. Since ECI providers are coaching parents how to do these activities directly with their kids, telehealth has proven to work really well in a lot of situations. Next slide. So we know ECI is effective, but the problem is that not enough kids are getting the full benefit of ECI. Right now, Texas only serves 2.34% of children under 3 through their ECI program. The national percentage is 3.74. So we are serving a very small percentage of kids and are much lower than the national average in terms of the number of kids that we're serving. We also see a lower percentage of infants, so those that are under 12 months of age, being served by ECI. And as we mentioned earlier, and as Laura mentioned, brain science shows that serving kids as early as possible is critical for positive development. So both the low percentage of young kids served and the decline in very young children being served is due in part at least to the fact that in 2011, the legislature reduced eligibility for ECI. This means that this resulted in missed opportunities for kids that had more moderate delays. And then Texans Care for Children also did a recent survey. Just a second. We did a recent survey and many of the ECI directors shared with us that they wanted to be able to do more outreach to identify more potentially eligible kids. They wanted to serve all of the kids that are eligible for ECI, but they have limited Child Find funding. Child Find is how ECI providers can identify kids in the community that might be eligible. It's kind of a way for ECI providers to get the word out about what early childhood intervention is, how to identify kids that might have delays. But ECI providers get very limited funding, and their ability to do these Child Find efforts have declined over the years. So this has been a problem for making sure that we're serving all of the kids that are eligible, and leads to this issue that eligible kids aren't getting served. We also know that that Black children are underserved in ECI in Texas. The percentage of Black children served by ECI is lower than the percentage that are in the Black children that are in the general population. So this is a problem, and we need to make sure that we're doing everything that we can to identify any kids that have delays and might need support from early childhood intervention. Next slide. So we'll dive a little bit more into some of these policy challenges as we talk about some of our proposed solutions and kind of our priorities for the session. But first of all, the first challenge is that the per child funding for ECI is way too low. I'll say more about this, but ECI providers are constantly required to do more with less money. Next, the pandemic has caused a lot of challenges for ECI providers. They've been super resilient. They've pivoted to telehealth services very quickly and have really rolled with the punches and tried to make sure that families are getting all of the services they need. But this has caused disruption in services. It's caused increased costs, like purchasing technology for families so they can participate in teletherapy, gift cards for families so that they can get phone data. Software to get e-signatures was a problem in the beginning of the crisis. So ECI providers are dealing with a lot during this time. And then, as I mentioned previously, funding for Child Find, which is the outreach efforts of ECI providers, is too low, which is leading to inadequate screenings and referrals for kids with disabilities and delays. And that's what puts Texas 46 in terms of the percentage of kids under 3 that are served by ECI. All right, next slide. So let's talk a little bit about the budget. A top priority for the ECI Advocacy Coalition that's facilitated by Texans Care for Children is protecting and increasing funding for ECI. So let's look at this chart on the next slide that shows what the funding has looked like over the past decade or so. This graph shows the amount of funding ECI providers receive on a per month, per enrolled child basis. I'll say this, I'm not a budget expert, and ECI funding is super complicated. ECI actually draws upon 17 different funding streams for the program, but this graph, despite how confusing the funding is for ECI, this graph clearly shows that there's been a decline in the amount of funding per child. There was a bump last session because of an exceptional item. So you see that in 2020 and 2021. However, this is obviously coinciding with the COVID-19 pandemic, but there was a boost in funding. However, when you look at that, even with that boost, it only put us on par with what the funding levels were in 2016 and 2017, which is when 5 ECI programs actually ended their contracts with the state due largely to funding challenges. So even though we saw this increase in funding, it's still too low, and it's only at about approximately the level that programs had when a lot of programs were deciding to leave the program because they couldn't make ends meet. And finally, kind of looking towards this session, we know based on what the Health and Human Services Commission has requested in their legislative appropriations request, that the amount of funding we're expecting for 2022 and 2023 are even lower than what you see on this graph, lower than 2018 and 2019. So on a per child basis, we're concerned that the funding is going to be very low. And we need to be serving more kids, not less. And we need ECI providers to have more funding to do more, not less funding to serve more kids with. So we'll be working hard to make sure that ECI programs receive the funding that they need from the state. Next slide. On this slide, these are kind of the key takeaways I want you to walk away with. And we'll share the slides, but the bottom line is that ECI needs more funding to serve all eligible children. If you have the opportunity to talk with any legislators, this is something that, that we need to make sure that they know, that ECI funding needs to be protected and needs to be increased. Next slide. So now I'll talk quickly about 3 pieces of legislation that we hope to see pass this session. The first one is by your very own Representative Mary Gonzalez of El Paso. We're very grateful that she has filed this piece of legislation, HB 168, on inclusive childcare. Next slide. So this is just a visual from the agency that they've been distributing to help people understand how early childhood intervention interacts with child care centers. So this piece of legislation, HB 168, would actually do a lot of different things, but the main goal is to make sure that early childhood intervention is something that child care providers are thinking about and aware of. So it has some pieces in the bill that would require some additional, not additional training, but would include training around early childhood intervention and working with kids with developmental disabilities and delays as part of the training that child care providers receive. It would also include making sure that child care providers know what ECI is and how to refer to ECI, so that if they have a concern about a child, they know where they can get support. So there's a lot of pieces in this legislation. I'm happy to answer any questions about it or provide additional information to anyone that's interested. Next slide. The next priority for the ECI Advocacy Coalition is a private insurance coverage bill. There are two bills that are filed both on the House side, and we're hoping that on the Senate side, Senator Zaffarini will file the bill as well. But this bill would require that some of the critical ECI services, such as specialized skills training and targeted case management, that they're covered by private insurance providers. Those services are already covered by Medicaid, but private insurance providers are not required to cover the cost of those services. This would only impact kind of a fraction of private insurers, those that are regulated by the Texas Department of Insurance, but still, I think it's about 16 or 17% of folks in Texas that have private insurance have insurance providers that are regulated by the Texas Department of Insurance. So it would be a good step in making sure that kids that have the private insurance and are getting ECI services, that those services are covered. Next slide. And then the final piece of legislation that we're really excited about is two bills that have been refiled, one on the House side by Representative Cortez and on the Senate side by Senator Zaffarini. And these bills are really aimed at trying to address our highest in the country uninsured rate for kids. Next slide. So as you can see by this graph, Texas has by far the worst uninsured rate for children in the nation. 12.7% of kids in Texas are uninsured versus 5.7% in the United States. This is the most recent data from 2019. And then if we look at the next slide, if we just look at young kids in Texas, this data is a little bit older, it's from 2018. But if we look at young kids in Texas, those that are under 3 that be served by early childhood intervention, 7.5% are uninsured. So it's a lower percentage. Kids that are younger are more likely to have Medicaid coverage and be insured, but still we have the highest in the country if we're just looking at young kids. Next slide. So we have a problem. We have a lot of uninsured kids. One of the reasons for that is that kids that have Medicaid coverage are kicked off of coverage or potentially kicked off of coverage mid-year. We have a really inaccurate system for kids that have Medicaid for keeping them covered. So this visual shows that when a kid gets their Medicaid coverage, in the green section, they have about 5 months, 6 months of continuous coverage. And then you can see in red, families might start to receive what are called periodic income checks. So on the back end, the state looks at different wage data to see if a family's income has changed. If it has changed, they get flagged and they get something in the mail where they're supposed to provide additional information. If a family doesn't respond within 10 days of receiving that request for additional information, their child likely loses their coverage. This could happen in months 5, 6, 7, and 8 in a child's year of coverage, and a child could potentially lose their coverage during that time. What we're asking with this piece of legislation is to do away with these periodic income checks and instead provide 12 months of continuous coverage for kids so that they can keep their Medicaid for a year, their coverage isn't interrupted, they're able to get services like their checkups, their early childhood intervention services, any services that a kid might need, they're able to get in. This is a top priority for the ECI Advocacy Coalition, as well as the Children's Health Coverage Coalition and the Cover Texas Now Coalition. Happy to talk more about this. It's complicated, and it really doesn't have to be as complicated as the state's making it. Next slide. We have a recent report here on early childhood intervention. It came out in November. I hope you'll check it out, and we'll also send a link to it in the follow-up information to this webinar. And then next slide. Here is my contact information, as well as if you want to follow me on Twitter to stay up to date with what's happening during the 87th legislative session, please do. And also we're creating a ECI advocacy toolkit that will have template letters, kind of just the rundown of if you want to reach out to your legislator, but you're a little bit nervous about how to do it, here's what you can do and here's what you should talk to them about. So I will also make sure that that gets shared with y'all when it's ready. Thanks so much. And I will pass it off now to Sabrina Gonzalez with the Texas Council for Developmental Disabilities. And thanks for your time.
Awesome. Hello, everyone, and thank you, Katie, for that amazing presentation. It segues so perfectly into our next presentation, which I will be giving on behalf of the Texas Council for Developmental Disabilities. My name is Sabrina Gonzalez, and I am so delighted to be able to present today and talk about such an important issue that all of you are familiar with, and that is ECI. I am a public policy analyst at the Texas Council for Developmental Disabilities, and today I'll be talking about what TCDD is going to be focusing on this legislative session in relation to ECI and early childhood more broadly. So next slide, please. And then one more. Thank you. So first I want to give a little background on who we are and what we do at TCDD. So the Texas Council for Developmental Disabilities is a federally funded agency and governed by a board of 27 governor-appointed council members. Our policy team works to educate legislators, elected officials, and the public on key issues impacting Texans with disabilities. And we support advocacy efforts that allow Texans with disabilities to be fully included in their communities and exercise control over their own lives. That is our mission at TCDD. And another really cool thing that TCDD is able to do is award grant funding to different organizations and entities that are doing amazing work on the ground in line with our goal of supporting Texans with disabilities. And we have the great privilege of having Paso del Norte as one of our grantees that we worked with in the past on multiple projects. And most recently, Paso del Norte is a grantee of our Policy Fellows grant. So Paso del Norte is able to onboard a policy fellow in El Paso to learn more about disability policies and advocate for the needs of El Paso families specifically in the Texas legislature and make an impact in our state house. And Laura Marquez, our policy fellow, has been doing an outstanding job, as you've seen in her presentation earlier today. And we are so excited to see what she accomplishes during her fellowship. Next slide, please. So here at TCDD, we have created a list of position statements that our council has created, which details the positions of the council and what TCDD holds central to our agency. And these position statements are our framework, and they inform how we best advocate for the well-being of Texans with disabilities. And we have a position statement for all major policy areas such as employment, housing, education, and others. And we have one in relation to children and families, which I thought was important in sharing because it can give some insight as to why ECI is a priority for us in the first place. Our position statement in regards to children and families states that TCDD supports the position that all children belong in families where they are loved and cared for with the opportunity to be successful and the potential for independence. And furthermore, we believe that families should have access to the supports and services necessary to provide sustained care throughout the lifespan of a person with a disability. And it is almost impossible to talk about this position statement and not mention ECI. Early childhood intervention services are inherently a part of those services necessary to provide sustained care, especially in those crucial early stages of life. And anyone who has benefited from ECI services can attest to this, and those of you tuning in can attest to this as well. So with that being said, ECI is inherently one of our priorities as a council, given this statement and our mission as a whole. Next slide, please. And when it comes to our public policy priorities, TCDD has some similar broad statements that serve as an umbrella for more specific policy areas that fall under them. And in relation to early childhood and inclusive education, We believe that it is important that children with disabilities receive necessary services to promote healthy growth and development to support long-term success and independence. And in order to reach these goals, we believe that children deserve access to quality care and education, therapy, case management, and other services that meet and hopefully exceed federal standards so that children with disabilities and their families are supported. That is our end goal, and that is the goal of many disability advocates on this call, and that's why we're gathered here in the first place. Next slide, please. So now that I've been able to explain a little bit about what TCDD believes in general and a little bit about our mission, I'd like to discuss what our goals are this session specifically and what we hope to see in terms of ECI and early childhood in general. This legislative session will be unlike any other that we've had in the past, and the COVID pandemic has hit many families with children with disabilities hard, and that's important to keep in mind when laying out our goals for this legislative session. Next slide, please. One of the most important priorities related to ECI, as Katie alluded to, is securing adequate funding. And we believe that it is so important that it takes place as our first early childhood public policy priority at TCDD. It is critical that we address the gaps between state funding and the needs of infants, toddlers, and families receiving ECI services in the state of Texas. As Katie mentioned before, and as we will continue highlighting throughout this presentation, there is a substantial gap in the needs of children and families in the state and what the state has allocated to ECI as a whole. And unfortunately, this lack of funding has had some real consequences. This lack of funding has meant that eligible children are not getting the services they need and that they're entitled to. Texas falls behind the nation in the number of infants and toddlers receiving ECI services. And over the years, we have seen the number of children eligible for ECI services continue to rise while the funding for ECI services continues to fall. And this is extremely concerning. The Department of Education investigated the state of ECI in Texas and found that the level of funding that the state has allocated has contributed significantly with ECI's under-enrollment numbers. And this hits minority families especially hard. And we see that Black infants and toddlers are underrepresented in ECI in Texas, and the pandemic and its impact have not made this any easier. Furthermore, we see that ECI providers are overwhelmed as well, and they are trying to do the best they can with the funds they've been allocated, but it is often difficult, as I'm sure many of you can attest to. And some ECI contractors have had to end their contracts with the state largely due to these funding shortfalls. And the pandemic has exacerbated these challenges, and ECI providers are being forced to find ways to do more and more with less funding. And these are direct consequences of this underfunding. And in the end, we want to make sure that all eligible children that can benefit from ECI receive these services. And in order to do that, the state must prioritize funding ECI. Next slide, please. Additionally, we want to support efforts to maximize and streamline funding for ECI. As Katie mentioned before, ECI is funded through many different streams, including state sources, which is like legislature allocation, federal sources that come out of legislation like the Individuals with Disability Education Act, family out-of-pocket payments, and Medicaid, private insurance, and CHIP. And all of this can get very messy, but there are several ways that have been identified to maximize funding and help the dollars the state has allocated to ECI providers go a longer way. For a quick example, the Health and Human Services Commission, in a report researching ways to maximize ECI funding, suggested exploring opportunities for Medicaid reimbursement of coverable Medicaid services that are not currently reimbursed by the Texas Medicaid program. In the end, we know that this requires collaborative work between state agencies, ECI programs, and lawmakers to support ECI providers and assist them in being able to maximize the funding that the legislature approves for ECI. Next slide. Another one of TCDD's priorities this session is to increase efficiencies within ECI, especially in the process of continuing eligibility. This is across the board, but particularly in continuing eligibility. Children receiving ECI services are required to prove that they are still eligible for services every 6 months. And this process can be tedious and confusing for families, and any error in this process can result in a child being kicked off and stop receiving these crucial services ECI provides. And for these reasons, we find that it is incredibly important to support efforts to make the process more accessible and user-friendly to families. Additionally, we support any efforts to study the long-term impact of ECI in Texas. And we're lucky enough to witness and hear about how ECI has changed the lives of its participants and their families. But being able to share that through data and statistics that the state has funded with legislators would be amazing and support our efforts to increase state funding for ECI. Next slide. And our final priority is ensuring that all families are fully educated upon transitioning out of ECI. We want families to feel supported and ensure that they know how to continue supporting their child and receive the services available to them after they age out of the program. And part of this involves making sure families are aware of Medicaid waiver interest lists and sign up for their children, that they sign up their children to the lists that they may be eligible for. And we know that families can wait on a Medicaid interest list for up to 15 years. So we want to make sure that families know about the services available to them and feel prepared to advocate for their child throughout their lifespan. We know how important it is to support and educate families, especially when transitioning out of ECI, and we want to ensure that families are prepared to leave ECI with all the tools that they need. Next slide, please. That was a very quick wrap up of what TCDD is going to be focusing on this legislative session, and we would love to have you guys keep up with TCDD this session through these various means. There are several ways you can do this. One is by signing up to receive our Texas legislative newsletter, where we give you a summary of what's happening at the Capitol and update you on important disability related items that are being taken up in the legislature. We also have something called Bill of the Week, where we highlight a noteworthy disability related bill to flag and some specific pieces of legislation we find particularly interesting. And finally, you can follow us on social media platforms. We have already begun providing short 1 to 2 minute video updates, keeping our followers in the loop on what's happening at the Capitol and what TCDD has been up to. So I invite all of you guys to keep up with us this session. Next slide, please. And I appreciate you all tuning into our presentation, and I hope that you all sign up to receive updates from TCDD this session. We have a lot planned, and we are in for what is going to be an extremely interesting session. So with that, I will hand it off to Carrie Judas and Jennifer Lucy at TextProtects to talk about TextProtects child protection priorities this session.
Right, thanks so much, Sabrina. So we're going to keep the conversation going about legislative priorities that we feel are critical for kids and families. So for those who don't know me, I believe you know most of the faces on this webinar by now, but I might be a new face to you. So my name is Carrie Judice, and I'm the CPS Research and Policy Analyst at TextProtects. So Jennifer and I are going to basically talk through our legislative priorities that we feel are going to have the biggest impact this session on child protection, and how you can get involved to really help move this work forward. So for those of you who may not be familiar with TextProtects, we are the Texas chapter of Prevent Child Abuse America. There we go. And really what we want to see is that children are protected from the trauma of abuse and neglect, and we really want to see that families are empowered to thrive. We really go about this work through a couple of different means: research, education, and advocacy. our work really spans across the prevention spectrum, all the way from child abuse prevention, which is, upstream and making sure families have the resources that they need, child protection, and making sure the system's working optimally for children and families, to behavioral health for survivors of trauma. So Jennifer's actually going to start us off, and she's going to talk about some of the research on what we know about children and families.
Thank you, Carrie. And thank you to all the presenters so far. I'm just learning so much and so excited to have us all together this morning. As Carrie mentioned, Tex Protects has deep roots in the prevention space. We've been really working on the prevention of child abuse and neglect since our inception. It's really part of our core mission. But in the time that we've been doing this work, the research on the impact of early adversity and the tools we can use to prevent it has changed exponentially. And so I wanted to start today with a little bit of those findings, because sometimes the numbers we look at, particularly in Texas around some of this work, can be quite overwhelming. You've seen it some in the uninsured rate that Katie mentioned, and the number of kids who aren't able to access ECI. And you're going to see some of those numbers in our presentation as well when it comes to child abuse and neglect. So I think it's important to remember at the beginning that we have more knowledge and more tools in our toolkit now than we've ever had before, and that we have evidence-based solutions that can be implemented to attack problems that have plagued us for centuries. We believe child abuse and neglect is preventable, and we need to stop asking our children and our taxpayers to pay for things that we know how to prevent. We've also learned that the prevention of child abuse and neglect is not a targeted, narrow piece of work, that it really requires multiple and diverse strategies across lots of sectors to be sure that families can access the right supports at the right time. And I mention that now because that's how what we're going to talk about now in terms of child abuse and neglect connects to what Laura and Katie and Sabrina have been talking about related to early childhood systems that work well together, where all the stakeholders are engaged and collaborating, and where parents have access to needed supports like ECI. So the research is clear. We've learned a lot, and I know that I'm singing to the choir on this call today, so I'm going to move pretty quickly through these items, but I do want to reassure you, because I am singing to the choir, that while this is commonplace knowledge in our field of work, and we've been singing this song for decades, this is not well known across the state of Texas or amongst our policymakers. And so there may be things that feel obvious to us that are still important to communicate to policymakers, to funders, to other movers and shakers in our community. One is that early life experiences are critical in building a solid foundation for life. So one of the things that's been clear is that these early foundations, these early experiences set either a firm or an unstable foundation for everything that follows in a child's life. We know that 90% of brain development happens before age 5. So one of the best ways to support healthy children and healthy futures for those children is to be sure that families have the support that they need. Unfortunately, we know that many families in those earliest days and earliest years are stressed and strained and don't always have access to those needed supports. We've also learned, and this is on the next slide, that adverse childhood experiences are prevalent. And when I say adverse childhood experiences, I mean significant and chronic childhood traumas like child abuse and neglect, or growing up in a home with a caregiver who is struggling with incarceration or substance use or mental health or family violence. And the research that's been done across thousands of families, several decades, and every state in this country continues to confirm that those early life experiences are not like ACEs are not rare. In the original ACEs study, 64% of American adults reported having experienced one of these things in their childhood. 25% reported having experienced child abuse and neglect or physical abuse as a child. 20% reported having experienced sexual abuse as a child. And those numbers hold pretty steady in the body of research through the years. And so I bring that up now because sometimes when we focus just on the 66,000 confirmed victims of child abuse and neglect this year in Texas, we are likely severely underestimating the scale of the problem. We also know that these early adversities like ACEs can impact biology, behavior, and health, not only in the short term, but because of that critical developmental window of early childhood, they affect health and behavior across the lifespan, such that Texans with an ACE score of 4 or more are twice as likely to have a stroke or heart disease. They are 4.6 times as likely to suffer from depression and 12 times as likely to attempt suicide. And so this makes what happens in early childhood a public health issue. And we know, we have the tools to prevent it. So we also know, and this is really the good news in the research, is that ACEs and trauma do not have to dictate the future of a child. Children who have protective factors, this is on the next slide. Children who have protective factors like healthy attachment to a nurturing caregiver, supportive home and school environments, access to community supports when needed, these children and these families can develop resilience and they can be healthy and be well despite significant challenges. And so prevention and access to those kinds of relationships, environments, and supports remains the most cost-effective means for really changing the trajectory for Texas kids. But we know this is not a one-size-fits-all approach. We have to move from, again, as I mentioned earlier, the idea of these sort of singularly focused child protection moves toward interventions and supports that create a system for family well-being. And to do that work, here on the next slide, we know that we have to move beyond the walls of a particular program or particular silo, agency, committee, and really work collaboratively across sectors, across agencies, across the state, to bring our strengths and expertise and access to families to the table to create smart solutions. And with that, I'm going to pass over to Carrie again to talk a little bit about the data.
So now that Jennifer's kind of walked us through the research that sets the foundation for the work that we're doing, I want us to spend some time talking about the data to see, how we approach child well-being and child protection here in Texas. In the last decade, the number of reports to CPS has overall increased, and that's reflected in that top green line on your screen. Then you see those bottom two lines. Those are the statewide numbers that reflect the number of confirmed victims and the number of confirmed investigations. And whether you're looking at statewide numbers or numbers specific to El Paso even, the numbers have actually fluctuated very little. Yet, if you look at this black line that's in the middle of your screen, that actually reflects the CPS budget. And you can see that there's been a steady increase over time. So what that tells us is that Texas is actually spending more and more money on the system once families have already reached a crisis, but not really seeing any sort of decline in the number of families that end up on its front door. And then you look at the recurrence rates for families who've actually received services in family-based safety services, or FBSS as we know it, which are really intended to prevent removals. You'll find that 4 out of 10 families were actually re-reported for abuse or neglect within 5 years of completing those services. In El Paso, the actual percentage is only slightly below the average at 40.7% recurrence within 5 years. And this statistic, again, another statistic that's been pretty steady over time and over the past decade. So that tells us something isn't working with the services that families are receiving. So here you see a bit of an overview of the system and what happens at a high level when the department receives an allegation. We know that responding once a crisis has occurred is expensive. And it's more costly for a case as it flows further into the system. Look at the numbers we have on this. It's $1,400 for an investigation, about $4,000 for an FBSS case. Again, where families are supposed to be getting services to hopefully prevent a removal, because look at the next jump here, almost $33,000 per child per year if the state takes custody. That's a lot of money. Whereas let's kind of contrast, kind of shift your eyes over to the left side of your screen. It could cost $600 to $5,000 total for an entire family if they were to be provided with evidence-based services to prevent child abuse or neglect altogether. So with these numbers in mind, we know that preventing 3% of removals, just 3%, could save the state approximately $20 million. But does Texas invest appropriately, kind of knowing that the further you go into the system, the more money it costs, and those cost-efficient mechanisms at the beginning? Historically, Texas really is only invested once a crisis has occurred, rather than trying to prevent the crisis. So for 2021, what you're looking at on your screen, Texas has only invested a small portion, which is about 5% of its budget on prevention. Whereas if you compare that to the CPS investment, that's about 87%. So we have a ways to go before we can truly say that we're shifting from a system whose investments reflect a proactive nature versus one that's reactive. And then what you're looking at on your screen here are the outcomes for PN3 outcomes for Texas. What we know is that for families with children under age 3 here in Texas, there's really work to do in order to set up families for success. So there's some things, and you'll get this on the slide deck when we send these to you for you to kind of analyze those a little closer. But really what we're seeing on these next 2 slides is that we need parents to be functioning at the most optimal level for their child. But when it comes to parents' health and emotional well-being, parents have little support. And we know, as you've heard from all of our presenters today, that that families are having families are having trouble accessing services that they need. And on this slide, you see 60% of children under age 3 are not receiving developmental screenings to determine what assistance or services may be needed. Families aren't really receiving the benefits that they're eligible for, and others are in need of basic necessities and perhaps really don't know where to go. So I know that you've heard this many times today, just kind of driving that point home a little bit more here. And then on top of that, we're in the middle of a global pandemic. So for families here in El Paso and across the state, we know that families are experiencing increased stressors, which can include social isolation, unemployment, which could even lead to unhealthy coping mechanisms such as, substance use, or maybe there's, ongoing mental health issues. So what you're seeing on your screen here are actually some projections, and those are based on unemployment rates. So if we look at the projections from the Great Recession, every 1 point increase in unemployment could correlate with a 15% increase in physical abuse and a 12% increase in emotional abuse. So again, we're talking about risk here. So now more than ever, it's just really critical that we respond correctly and timely to provide families with the supports that they need to remain safely together. So I'm just going to leave this on your screen just for a second to kind of digest this. So based on the research, based on the data, and knowing how the system, works and how they invest their dollars, what grade would you give our child welfare system? We rank 43rd out of 50 when it comes to how we do child welfare. I don't know about you guys, but that is definitely not the legacy that we want to leave here in Texas for our kids. And so we have to do better. And so what do we need to do? Jennifer's actually going to start walking us through those next steps.
Thank you, Carrie. I saw a comment in the chat as you were talking saying that this is startling data and that we need to be doing more. And of course, all of us here today 100% agree. I've been thinking, kind of anew about these rankings in context of a new administration at the federal level, and that 1 in 10 American children live here in Texas. So being, having the most uninsured kiddos, being 46th out of 50 on access and 43rd out of 50 on child welfare is not okay. It affects not just the work and the health and well-being of Texas, but of our entire country. And so based on the research, based on the data, and I would say based on the continued crisis in our CPS system, as well as some new opportunities embedded in the Family First Prevention Services Act and the community-based care approach to foster care and prevention here in Texas, we think it's time to shift the paradigm. It's past time to shift the paradigm. And so for the Tex Protects team, our primary goal for the 87th legislative session, next slide please, is to strengthen proven strategies to prevent abuse and keep families together. This involves, well, I'll pause for a moment and just say there was a quote on the prior slide that, that I hold on to a lot, and that really points to just our impact increasing if we can support families before they go over that first waterfall. And this, of course, sort of aligning with that, the popular analogy of our upstream work versus our downstream work. And so to do that well, we look at strategies across the prevention spectrum. So in our work, we talk about primary prevention strategies as being those that provide supports to families before the first occurrence of child maltreatment. And those primary strategies might be available population-wide, or they might be more targeted to certain populations who might be at risk for particular reasons. We also have secondary prevention strategies, which really focus in and try to prevent maltreatment among families who are considered at high risk and who may already be in some form of crisis. And then tertiary prevention focuses on mitigating the negative effects of child abuse and neglect and preventing reoccurrence in families who have already experienced maltreatment. And so at a glance on the next slide, you'll see the Tex Protects policy agenda for this session really distributed across that spectrum. And you'll also notice that the bulk of our agenda this session is in that primary space with the intent of using what we know in the research to intervene early, intervene with proven strategies so that children and families in Texas do not show up at the front door of the CPS system. And we think this package of policy agenda items represent feasible and cost-effective and relevant strategies that can move Texas toward doing more of what works and less of what doesn't. So I'm going to run quickly, or Carrie and I are going to run quickly through some of these strategies. And I want to send a shout out to all of you on the call who are getting so much information today that your head might be spinning a bit. And so want to reiterate that we have more resources on all of these topics. You'll get the slides, and please feel free to reach out with questions. So We're going to start with the strategies on our agenda that are universal and primary prevention strategies. So as many of you have experienced during COVID, if not before, there are so many barriers to families getting connected, plugged into the network of supports that exist. And I love that analogy that's embedded in the Help Me Grow work about families getting plugged in to the grid of resources that is available in the community. And that is a critical piece of preventing child abuse and neglect in our communities. We know that programs and funding mechanisms in this state for young families can be quite fragmented. And so we don't want the consequences of that fragmentation to fall on our families and prevent them getting connected to what they need. And so one part of our agenda to that end is to talk about ways to strengthen 211 to become a better front door for Texas families. And this is a budgetary priority. 211 hasn't had significant investment in over a decade, despite having seen increased needs, particularly during the pandemic, as families dial 211 to start the conversation about how to access what they need. And we think there are also ways within current capacity that 211 could be more innovative and more flexible, so that, for instance, local 211s can connect to the work happening with Help Me Grow resource and referral networks, and that families with young children who call into 211 could be connected to parent navigation systems that are specializing in the needs of young families and can get them connected in ways that are effective. We also know 41% of calls to statewide intake for child abuse and neglect are screened out, as there isn't enough evidence to justify an investigation. Those families also would benefit. We know they're at risk and there is a need within that family, even if it is not child abuse and neglect. And so connecting those screened out calls to local resource and referral networks could help get them connected to what they need so they don't call back later with more severe crisis. In addition, because of what we know about the impact of childhood adversities and the impact of those adversities, we'll be working this session with Representative Parker to refile a bill we worked on last session around preventing and mitigating the effects of adverse childhood experiences. Now more than ever, we need a coordinated and strategic statewide strategy for how we are going to prevent these childhood adversities and ensure that our systems are effective in mitigating their effects. This bill intends to create and implement a statewide strategic plan to address the causes and the symptoms of ACEs so that the state agencies can come together and consult with providers and communities on the ground, coordinate data, evaluate our prevention needs and our gaps in services, and identify best practices and efficiencies in what we need to be delivering statewide to keep children. And then finally, on the universal and primary bucket, we're going to be working to expand access to universal newborn nurse home visiting. One of the programs implementing this strategy already in Texas is called Family Connects. This is on the next slide. And this model starts by connecting new moms, connecting with new moms after they've given birth and they're still in the hospital. And every mom in the hospitals that adopt this program are offered a newborn nurse home visit 3 weeks postpartum. And 85% of moms say yes to this offer. If you've been a mom yourself, I think you can relate to that, that land between going home with a new baby and perhaps your 6-week checkup with your OBGYN. And some of us were lucky enough to have support of families and communities, but not everyone is. And so for moms who say yes, a nurse is able to visit 3 weeks postpartum and do health screenings and ask about mental health, and then connect the family to any resources in the community that they might need. The program has shown a $3.17 return on every dollar invested just in preventing emergency room costs. And there are also impacts to maternal mental health, positive parenting, and the reduction of child abuse and neglect. It's a pretty great return for a program that basically takes a couple of hours. It's currently only in 5 counties here in Texas and is being implemented with funding through some federal funding streams that come through DFPS, as well as philanthropic and local support. And so we're going to be working this session on identifying some other funding mechanisms that could expand access to this program, and creating an administrative mechanism that could accept those funds and then roll out grants to communities to do this work. Okay, next is targeted and primary. And so many of the most effective child abuse prevention and family support programs being implemented in Texas are being funded through the Prevention and Early Intervention Division at DFPS. And it's important to note, and you'll see it reflected on this slide, that this is a separate division from CPS, and that the PI division really functions like a grant-making entity, resourcing community contractors who choose the right evidence-based programs for their community. In my mind, this was the original community-based care, where the state really backed up from prescribing what was right for a community and instead resourced the community to take ownership of that work and develop a system of supports that was right for them. Project Hopes, as well as the military initiative, are both operating in El Paso using these funding streams. And one of the foundational pieces of those prevention strategies is family support home visiting. There are many different models operating around the state, but they all share the approach of providing voluntary services to families. This is on the next, just go to the next. Yeah, there you go. Provide voluntary services to families in the home. So think of it as one part community health worker and case management and one part parent coach. And so this gets at the resource and referral piece again, as well as parenting support and the prevention of child abuse and neglect. And so you'll see on the next slide that these programs have a proven return on investment, demonstrated impacts. They help keep children safe, they keep families well, and they save taxpayer dollars. Texas is really a leader in making these programs available, but we are still only reaching 4% of the families who have children under age 6 and are most likely to benefit because they have 3 or more risk factors. So we'll be supporting the PEI exceptional item request for an additional $10 million for expansion of these prevention programs, but we will also be pointing out that even with that additional funding, we're really only putting a drop in the bucket of the need. And if we want to actualize the potential impact of these programs, we're going to have to go bigger. And with that, I'm going to pass it off to Carrie to talk about the secondary approaches.
Yeah. So if y'all remember from Jennifer's layout earlier, the secondary prevention efforts are those that target families who are at high risk of child abuse or neglect. And so what we're going to be kind of doing in this bucket is supporting the state's budget ask to leverage the Family First Transition Act funds, which are actually federal dollars that were given to states to actually help implement Family First Prevention Services Act, or FFPSA. And more specifically, we want to support the state's ask for how they want to spend the prevention portion of those dollars. So Texas received about $50 million, and DFPS has actually indicated that they want to use about 33.9 of it towards prevention. And so we want to make sure that we protect those dollars for prevention. And so by now, I imagine all of you are experts in FFPSA, but for those of you who might need a little bit of a refresher, remember that this is federal legislation. It really provides a tremendous opportunity to transform the system from one that focuses on, or it actually does focus on prevention to keep families out of the system altogether. Again, you heard me kind of mention that proactive versus reactive nature, and we really want this system to become proactive. Unlike before, Title IV dollars can be used to actually address the drivers of child abuse or neglect, and states can basically draw down a federal match for prevention services that are trauma-informed, evidence-based, that are mental health services, substance use treatment, and in-home parenting supports. And so again, those services are really meant to keep families together and keep children safe. And so these prevention services are meant to target families that are at imminent risk of entering foster care. And the department has actually determined that the families that kind of meet that standard, that definition, are those that are already participating in FBSS that you heard me talk about earlier. But unfortunately, those recurrence rates are not so great. So you know, I do think that Family First gives a great opportunity here to kind of change the way that we're approaching services to make sure that they are programs that work and basically hopefully produce some better outcomes for these families because again, we want to try to prevent those removals. And so for Texas, FFPSA is going to be implemented later this year in October. And so Texas really needs to be prepared and would benefit from taking full advantage of the funding opportunities that are provided with Family First. And so we do want to see them be strategic with how they use that $33.9 million. And then we have, you know, we kind of have this tertiary, which again is where abuse or neglect has occurred and we're trying to prevent recurrence. And so we really need to make sure that there is better access to child welfare data. There's a lot of pressure on the system to change. You heard Jennifer talk earlier about community-based care, and then as she called it, the original community-based care, where there are prevention services being provided in the communities voluntarily to families. And so we really need to make sure that these communities are resourced well, that they have the information that they need to keep kids safe and to provide families with the services that they need. But historically, DFPS has really only provided the majority of its critical child abuse data annually. This is the information that if you ever poked around on their website in the data book that they provide once a year, but you have to wait till January, February to get those new numbers. They do provide some reports in those rider reports, which, at most you can get information quarterly or maybe twice a year. The only information that historically DFPS has provided monthly are for kids in care, such as the types of placements that they're in and their levels of care. But we're really pleased to see that the department has started on their own volition to start keeping what they're calling an executive dashboard on their website. And basically it has things like staffing and caseloads, the volumes of reports to statewide intake, the numbers of stages that have been, or the number of stages that have been open in their different service areas such as FBSS, investigations, conservatorship, and those things. And then the average time to closure for each program. And so they also have, I think, the timeliness of investigations and the breakdown of the different types of exits from care. So it's really some great opportunities in here for us to get more information, but we do think that there's some information that's missing. And so, what we want to see not necessarily just at the stage level, but broken down a little bit more, like the type of allegation that came into statewide intake and like the number of children that are in each family in those age ranges and race and ethnicity. Again, they keep this information yearly. We just want them to do it more frequently. And so what we want to see, one of our priorities here is to see that the information in that executive dashboard is codified into statute. And then we also want to make sure that it reflects some of that additional information broken down a little bit more that I was talking about earlier. And then also that, that they can access third-party entities, you know, such as like a university that would be able to help them collect and analyze and report that information. And so you heard Jennifer again talk about community-based care earlier, and then you heard me kind of mention that shift to communities, but let's look at that a little bit closer. Look at the rollout here. We've got community-based care already operating in 4 different areas, 2 of which have case management responsibilities. We've got another area that they're trying to procure a contract. And then this coming biennium, the department has already said we want to expand into 4 new catchment areas, which are 3 East, 4, 5, and 9. And so, you know, with this shift to communities, it's just going to be more and more important that they can access the information, that they can know positive and negative trends in real time so that they can respond accordingly. And so that really just kind of ends our discussion as far as like what we are going to be pushing this session. But Jennifer, if you could go ahead and come back on the screen, she's going to talk about ways to get involved.
And this is really the most important purpose of today. Certainly, we wanted to let y'all know what priorities we were all going to be working on, but none of this works without you. And so we want to be sure that as we resource you with information, we also resource you with ways to stay in touch and stay connected and get involved throughout this legislative session. As several of us have mentioned, this session is not going to be a normal one. It's always true that the voices of constituents get more done than the voices of advocates in Austin. And so because access to the Capitol and committee hearings are just all going to be really, really different this session, that is more true now than ever. It's also true that there's limited capacity by our lawmakers and a tight budget and lots of competing interests. And I've heard lawmakers say before, you know, early childhood advocates just aren't the ones beating down our doors. This doesn't seem to be something our community really, really feels passionately about. And I don't think that's true. And so we want to make sure that we can resource you well to follow the work this session, to use your voice, use your network, to make sure that our lawmakers know that this is indeed what the El Paso community cares about and wants prioritized with funding and bills this session. And so on the next slide, I'm trying to remember what's there. You know, several other speakers have mentioned there's lots of ways to stay connected with our organizations through session and through webinars and reports and Twitter and Facebook and newsletters. We do our best to keep you engaged and let you know what's happening and when it's time for you to speak up, and then to give you resources that can help you do so as easily as possible. And so Katie mentioned an ECI advocacy toolkit. We have some toolkits on our website as well that have easy talking points, scripts to make phone calls, drafts of letters that you can send, Twitter posts that you might be able to make to get the attention of your local lawmakers and help them understand the values and the needs of the El Paso community. If we can, what's on the next slide? I've forgotten. Okay, this is how to stay connected with us. And then I think there are some of our reports on the next slide, which go into more detail on lots of the things we've been talking about today. But really want to reiterate our thanks in your joining us today for the work that you're doing in El Paso for children and for families. I know from my time with you that you are innovative and connected with each other and doing amazing things. And we want to make sure that we can help amplify what we know about what's happening in El Paso in the meetings that we have with lawmakers. And we also resource you well so you feel confident and comfortable to do that work also. So please don't hesitate to reach out to us. I know I speak for Laura, Katie, and Sabrina as well, that we are committed to resourcing you well to use your voice to stand up for Texas kids and their families